In 2008, archaeologists stumbled upon two skeletons that were around 9,000 years old. While it's challenging to pinpoint the exact cause of death for these ancient individuals, their bones revealed an infection from a bacterium that's all too familiar. Known to the Greeks as physis, to the Incans as Chekionke, and to us as tuberculosis TB, this disease remains one of the world's most deadly infections, surpassing malaria and even HIV/AIDS in terms of mortality. So, what is TB, and why does it continue to be such a persistent threat? TB is caused by a bacterium called Mycobacterium tuberculosis. This bacterium is typically spread through the air and settles in the lungs, where it causes an infection. The body's immune system responds by sending special cells called macrophages to the site of infection. These cells try to engulf and destroy the bacteria. In many cases, this immune response is successful in eliminating the bacteria. However, if a person has other health issues, like malnutrition, HIV, diabetes, or is pregnant, the immune system might struggle to control the infection. In these cases, the bacteria can multiply inside the macrophages and form colonies in the lungs. As the bacteria continue to infect and destroy lung tissue, they release enzymes that cause further tissue damage. This damage leads to symptoms such as chest pain and coughing up blood. The loss of lung function results in a lack of oxygen, triggering a cascade of hormonal changes, including reduced appetite and lower iron levels. The infection can then spread to other parts of the body, such as the spine, kidneys, intestines, and brain, causing various symptoms like back pain, abdominal discomfort, headaches, and even altered consciousness. This often results in the classic signs of TB, significant weight loss, a severe and bloody cough, and pale skin. In Victorian England, TB earned the nickname White Plague due to its striking symptoms and its prevalence among impoverished artists and poets who were more vulnerable due to weaker immune systems. The disease's ghostly appearance and debilitating effects also fueled myths about vampires. Despite these misconceptions, this era marked significant progress in the fight against TB. In 1882, German physician Robert Koch identified the bacteria responsible for the disease. 13 years later, Wilhelm Röntgen's discovery of X-rays revolutionized the diagnosis and monitoring of TB. These advances led to the development of vaccines, starting with smallpox and followed by the BCG vaccine for TB in 1921. These milestones paved the way for modern antibiotics, which are now our primary means of treating TB. However, antibiotics face a major challenge. About 90% of TB cases are latent, meaning the bacteria can lie dormant without causing symptoms. This makes it difficult to diagnose and manage TB effectively. Even when TB is identified, treatment can be lengthy, up to 9 months, with multiple drugs and potential side effects. This complexity often leads to incomplete treatment, which can result in drug-resistant strains of the bacteria. TB remains widespread in about 30 countries, where other health issues can worsen the situation and hinder access to treatment. Additionally, stigma around TB can prevent people from seeking help. To combat this, experts are pushing for better diagnostic tools, faster-acting antibiotics, and more effective vaccines. For example, a new urine test can deliver results in just 12 hours, and a promising oral treatment might reduce the treatment time by 75%. With these advancements, we might finally be able to eradicate TB and consign it to history.